continue to run into it day in and day out. By running this CRDP, Reducing Disparities Project, I traveled to many counties in California, and one of the county ethnic service manager came to me. She told me that we have 16% API population in our county, but we only have 1% of the people, of them come into our system. So if we continue to leave it to this county, we probably will continue to run into the same problem. So it is very important. I want to talk about my third point, that Reducing Disparities Project, that $60 million should maintain as a whole at a statewide level. If you divide it by counties, not only you may run the risk of 58 counties plus 2 cities, different plans. Some counties may easily say that we don't have enough population, we don't have enough money, let's not deal with this population. Then we continue to have this great disparity. The last one is that when we have resources, it's very important. Part of the problem, we don't have the accurate assessment of current situations. We do not have disaggregated data. So when we have the resource, we should try, or even if we do not have the resource, we should try to find resource to establish some disaggregated data. Thank you.
Thank you, Doctor. Next witness.
Good evening. I'm Joseph Robinson with the California Association of Social Rehabilitation Agencies. CASRA is a statewide association of private, not-for-profit, public benefit corporations that provide services to clients of the California public mental health system. We've sponsored or been involved in the development of legislative initiatives in California since the late 1970s, beginning with the Community Residential Treatment Services Act. This act was the first attempt in the nation to articulate the goals, values, and principles of a community-based system of services that was based upon the promises of growth and recovery. This legislation outlined and funded the development of small social model residential treatment programs to serve as alternatives to their institutional counterparts, primarily hospitals and nursing facilities. We believe that the restructuring of the Departments of Mental Health and Alcohol and Drug programs do provide opportunities to improve treatment outcomes and, yes, improve efficiencies. Specifically, this is an opportunity to increase the use of crisis and transitional residential treatment programs, which are critical to addressing the high cost of hospital and other institutional 24-hour care. As developed in California, crisis residential programs cost about $350 per day and serve individuals who would otherwise be hospitalized. Transitional programs provide a behavioral health care analog to the physical rehabilitation 24-hour service. In addition, the recent mental health and substance use needs assessment submitted to the Department of Healthcare Services found that the mental health rehabilitation had an average expenditure rate of just over $1,000 per user rate, while psychiatric hospitalization had an average expenditure rate of almost $21,000 per user. Clearly, the increased utilization of psychiatric rehab services from alternatives to institutionalization and 24-hour care to intensive community services, including supportive housing, education and employment, peer support, and self-help, will reduce emergency room use and hospitalization, homelessness, and incarceration, while enhancing community tenure, increasing employment, and ability of those with mental illness to self-manage their disability. Thank you.
Thank you for your testimony. Next witness.
Good evening. I thank you for your endurance and attention to this important issue. My name is Jane Adcock. I'm the Executive Officer for the California Mental Health Planning Council. The Planning Council was established in the early 1990s in response to the first realignment. We were established as a voice for the people at the local level. Our Planning Council is comprised of both direct consumers and family members, providers, advocates, county administrators, and some state representatives. I'd like to point out that at least half of our Planning Council is made up of consumers and family members. We do have a voice from the local level. Collectively, we have over 100 years of experience with California's mental health issues, and we advise the legislature, as I mentioned, during the first realignment. We've also authored the California Master Plan for Mental Health Services. Many of the concepts from the Master Plan were written into the Mental Health Services Act. My purpose here today is to reaffirm our commitment to improving California's mental health system and also to fulfill our pledge to your constituents and all of our stakeholders to bring their concerns to your attention. Primarily, I would like to bring forth issues such as the 5 principles for the Mental Health Services Act. They need to be imbued in all mental health care programs. I was heartened by Toby Douglas's commitment to in continuing the tenets of the Mental Health Services Act, not to be subsumed into a medical model. We really would like to continue and ensure that that does occur. Also, we want to echo comments made before about the importance of stakeholder involvement in the design of public programs and the expenditure of public dollars, and also for the importance of the location for the Office of Multicultural Services. Planning Council has gone on record as advocating for a separate mental health and substance abuse entity modeled more after the federal SAMHSA. We feel that this would mirror the federal government's model and create a more streamlined approach to the two issues that are often hand in hand yet face disjointed services. Thank you for your time.
Thank you for your testimony. And last but not least, please.
Last but not least, my name is Rick DeGette. I'm the Director of Vocational Services for Alameda County Behavioral Health Care. So maybe it's timely that I come last and urge the committee and others to think about how employment is central for folks in recovery, both transition age youth and adults. And our program is currently involved in working with Dartmouth College's Supported Employment Center on an international learning collaborative project to implement an evidence-based practice for employment services. And we're trying to braid together a funding strategy in order to finance the service, because there is no current sole source that we can bill for employment services. Some of the states that are involved in the Learning Collaborative include states that are billing Medicaid under a 1915 amendment to their Medicaid regulation, which California currently has not implemented. And I think it would be timely if we could consider looking at something like that as a statewide option for funding services. Just for folks to know, if you ask a given population of persons served with severe mental illness, 70% would say they'd like to have help to go to work. We currently have about 8 and a handful of other employment services specialists working with individuals to help them get and keep competitive jobs. We clearly have a lot of work to do. In our system in Alameda County, we have 4,000 adults and about another 1,000 transition age youth. So if you do the math, you can see how many employment services staff we really need. And if we had a dedicated funding stream, this would greatly enable us to work. I would also urge a statewide-ness kind of approach through the Health and Human Services to take this on as a policy initiative, because this is a core part of recovery as defined by SAMHSA these days. Thank you very much.
Thank you for your testimony. Seeing no further public witnesses, I do want to first, let me just I want to thank department heads, deputy directors, etc., for staying through the testimony of the panels and the public witnesses. I would like to afford you an opportunity, not require it, but if anyone feels compelled to acknowledge or respond to anything that you've heard since you were up here, I would invite you to return. If not, I would invite you to take to heart, to your departments and to the administration, what's been gleaned from these hearings. I've found it incredibly valuable, although I have to say somewhat concerning, the many moving pieces and at stake the human lives and some of the most fragile human lives in the state of California. So I believe I speak for our committee in wanting to maintain very close oversight of the transitions, the implementation of these transitions, and of the Affordable Care Act. Some of the themes that have come through has been the importance of ongoing state oversight, particularly with respect to the diversity and equality sensitivity of how these programs are implemented. Before we adjourn, I want to especially thank the staff of all the committees who have done such a wonderful job. Let's give them one of our silent thank yous, but knowing that it comes through very loudly. We appreciate all the hard work of staff members, and I'd like to afford committee members, if you have any final comments at this point. Ms. Atkins.
Thank you. Just lastly, it came up in the last panel of, it came up in the public comments. You know, the early mental health initiative and the $15 million and the discussion about budget dust, because it is in the scope of things so small, and the Department of Education being so, I took his comments to heart, and I actually think it's worth some type of response or at least follow up at some point. Not necessarily now, but I wanted to underscore that point because I thought it was a very good one. Thank you. And thank you all for being here so late. I really appreciate it.
Thank you, Ms. Atkins. Ms. Mitchell?
Thank you, Mr. Chair, for leading us through this journey we've all been on today. I was hoping to secure a commitment from the departments impacted, that we will hear these issues again in the subcommittees. And we talked about a number of committee members not asking all their questions. And if they are submitted to you in writing, if we could start our subcommittee hearings with you responding to those questions, hopefully we can build on today's experience as opposed to a regurgitation of today's experience when we have our budget subcommittee. So if we can get the commitment from the department that they'll respond to our questions, I know that we'll have staff compile them from all the members. Some of these questions that we've added at the end, just to make sure that we, again, it's a value-added experience, and some of the witnesses who may not join us again will know that those issues will continue to be put before the departments, and we'll continue to push until we get clarification and answers. Thank you very much for the opportunity.
Thank you, Ms. Mitchell. And also, I just want to echo some of the comments related to workforce, not just with respect to implementation of realignment, but perhaps more challenging implementation of the Affordable Care Act, where we've heard of the millions of Californians currently without coverage who will gain eligibility and access. And I think as we look at the continuing unemployment trends in the state of California, we need to link these efforts with our educational institutions, starting in middle school, high school, community colleges, and on up, to start investing in that next generation of providers, counselors, the professionals, the professional network, essential for us to be successful as we establish these goals and these markers. Clearly many other areas for us to follow up on, but the hour is late. I want to also thank our sergeants for their service this afternoon. Let's give them one of our thank yous. And a final thank you to all of you who have stuck with us through the process this afternoon. Thank you very much. We look forward to our follow-up with all of you. This meeting is adjourned.